Hello, I'm Eric Prosher, and you're watching CAN TV. Um, we're from Jesse Brown VA Medical Center, and today I have a special guest from our center. Her name's Miss Rebecca Powers, or Becky Powers. Also, Becky graduated from Loyola University Chicago with a dual master's degree in social work and women and gender studies, and received her Bachelor of Science in Psychology from University of Wisconsin. And she is currently the program manager for our spinal cord and injury clinic at Jesse Brown VA Medical Center. And she is also the co-founder and co-chair of Jesse Brown VA's Lesbian, Gay, and Bisexual, Transgender, and Ally Special Emphasis Program, and the facility's LGBT Veteran Care Coordinator. Thank you, Becky, for coming in.
Thank you for having me.
I forgot to also notify that today we're going to be talking about LGBT issues, as it is the month of June and is a special month considering current events and the tragedy that happened in Orlando not too long ago.
Mm-hmm.
There was a message that came from VA Central Office, and I just want to read a little part of it that is the official stance that the VA has with on the issue. The Department of Veteran Affairs is proud to observe the Lesbian, Gay, and Bisexual, Transgender, LGBT Pride Month during its traditionally recognized month, June. And this year's theme is Transforming the VA. LGBT Pride Month is observed to recognize the impact and contributions that LGBT individuals have made and continue to make in society and the workplace. And the VA must have a workforce that's reflective of society where all persons are valued and respected, so that VA maintains the highest quality of care to our veterans, including LGBT veterans. Yes.
Yes.
So would you tell us a little bit about your role in helping Jesse Brown VA to do that?
Absolutely. So if you look at the history of Pride Month, it began, I believe, as a reaction to the Stonewall riots, which were I think it was in New York City that these riots happened, and it was at some gay nightclubs, similar to what happened in Orlando a couple of weeks ago. And we think about that, 50, 60 years later. But then we had an incident in Orlando that happened just a couple weeks ago that was the largest mass shooting in our country's history. And I think we should start by just acknowledging that, there are a lot of politics surrounding what happened in Orlando. We can have conversations about gun control and religious freedom and all of that, but I think at its core, we really need to recognize that the incident that happened in Orlando was a massive hate crime, and it's really just evidence, I think, of why LGBT people don't necessarily feel safe walking through society, and that includes when they come to the hospital and when they're seeking care at the VA. And then, you think about the history of LGBT people in the military and the Don't Ask, Don't Tell policy, which was just repealed in 2011.
Yes.
And before that, LGBT people were discharged because of their sexual orientation on a regular basis. I think under Don't Ask, Don't Tell, 12,000 officers were discharged because of their sexual orientation.
Wow.
And so that's just an added component, I think, for LGBT veterans. They, it's a complicated history.
Yes,
there.
yes. So, very complicated history, and I guess it's better late than ever to get the balls rolling. And so, could you tell us a little bit about some of the programs that Jesse Brown VA has implemented and your role in these programs?
Yeah. So I started at Jesse Brown 4 years ago, and it was about 3 years ago that another social worker and I decided to start the LGBT Special Emphasis Program, which is housed under EEO, so the Equal Employment Opportunity Department. And it's basically the goal, it's a committee. The goal of the committee is to increase visibility of LGBT staff and veterans at the VA facility at Jesse Brown. And so we do a lot of...
Yeah, how do you do that?
Yeah. We do.
Because I imagine that could be a tricky issue. Like maybe some staff don't want their business to be out, and
Absolutely.
others do. So
Absolutely.
So
And
how is that done?
well, you know, it's an individual's choice whether or not they want to be out at work. And we respect that choice, absolutely. But we also want to convey that our facility is an accepting and safe place to be. And so we have implemented a lot of educational initiatives. We've done a lot of staff trainings. We have hung up even just something as simple as a poster in the hallway that says, you know, you're welcome here.
Yes. I've found a little clip on YouTube. Maybe we can see that. And I just want to cut away for those that have just joined us. You're watching a live call-in interactive program. We're Jesse Brown VA Medical Center, and we're talking about LGBT issues. And this is special guest Becky Powers. So here is a little clip from Fox News that talks about one of the VA programs similar to ours, but it's in another location.
Gay and lesbian veterans at the Dayton VA. As Wale Aliyu shows us tonight, it all stems from the repeal of Don't Ask, Don't Tell.
When it comes to gays in the military, equal opportunity has rarely been practiced.
It takes time for people to change their belief, change the words that they use.
While many VAs have program managers for LGBT veterans, the Dayton VA Medical Center has never had one. Carol Courtney is a therapist at the...
All right, so that was Dayton VA, but you are our equivalent here at Jesse Brown VA. They said something about the Don't Ask, Don't Tell, and you touched a little bit about how that affects the culture in DOD, but would you also say that that also impacts the culture of the VA?
I think it absolutely does. And, you know, whether we want it to be or not, the VA tends to be seen as an extension of the military. We have a lot of veterans that work at the VA, and that's a good thing. We have a lot of, you know, the culture is one that I think in a lot of ways is very similar to the military. And you think of the military as being this very kind of rigidly masculine culture. And I think in a lot of ways the VA is similar to that. And even if, you know, there are programs and initiatives, and in reality we want it to be, and we're working towards it being a more inclusive environment, it's all about people's perceptions. And if people feel like they're going to be treated like they were when they were in the military, then they're not going to be coming to the VA.
Right.
And that's exactly what we are trying to combat.
That's really important, and the posters is
Exactly.
one way to send the message out there. When I was we have a caller already. Hi, caller. What is your question?
Yes, thank you for taking my call. I wanted to make a couple of points, and I do think that you are correct that the VA is in many ways a reflection of the military, which can be a double-edged sword. On the one hand, it allows for those who need help to seek it out amongst a group of people who they can relate to, people who understand military service and so forth. So that's the upside of it, obviously. The downside of it, unfortunately, is that the military, you know, is not exactly known for its notion of empathy and sort of sensitivity. And you know, let's face it, anyone who served in the military knows that, you know, that the idea that real men or anyone who's tough, shall we say, men or women, suck it up, you know, you deal with pain on your own, you deal with any issues that you have on your own, you sort of muddle through it. And asking for help or needing help of any sort or complaining about the fact that you're not getting the needed help, you know, is seen as a sign of weakness or a sign that, you know, you're not, you know, as tough as you were supposed to be, or what the military told you were supposed to be when you were serving. So I do think that you're getting this sort of, again, double-edged sword, sort of contradictory message. And so it really does depend upon, you know, the individual who's helping you. If you've got someone who can relate to military service and there who perhaps is a doctor, but at the same time recognizes that we're not talking about people who are serving any longer. No one's fighting a war at a VA hospital. And, it's all right to tell the world and your doctor about, the things that are bothering you, the things that hurt, the things that cause pain in your life. And we need to really, again, enter sort of, say, the 21st century with regard to the treatment that we're giving to our vets, because, a lot of them are carrying around a lot of this with them, physical and emotional and psychological trauma. And we need to let them know that there's a safe place for them to go, and that they can communicate this without being made to feel like they're less, masculine, less of a warrior, just because they're letting people know that this is what their problems are.
Absolutely. I think you said it much more eloquently than I did.
Yes. And maybe I have a question for both of you. So if, a potential veteran that was checking out services, what would that veteran look for in an organization, in a hospital like Jesse Brown, to know that employees and staff are open to working with LGBT and community?
I mean, I think from my perspective, my hope would be that a provider would be able to see the complexity and how being a veteran and being LGBT kind of makes their care that much more complex in that way. And that kind of goes back to how Don't Ask, Don't Tell and the culture of the military, and to some extent the culture of the VA as well, impacts their lives. I mean, for many people, being a veteran is it's part of their identity, and being LGBT is part of your identity. And my hope would be that a provider would be able to recognize that and treat you respectively in that way.
Yes.
And if I might intervene, we may be able to take a lesson from other movements, such as the women's movement, that has argued in certain instances that there need to be carve-outs, places where women can go to be with other women and to feel safe and secure, and to interact with them, such that that they don't have to be worried. And the question is, can veterans hospitals and medical centers and so forth, can there be some a carve out whereby if this is who you want treating you, that you can go ahead and have that option? People who have this background, people who are willing to work with gay, bisexual, transgendered, and so forth individuals, can go to see Dr. A because he's part of that, and the nurses and so forth. I don't know if that's feasible, given that it would require certainly more resources, but there are certainly examples within other movements, as I've said, the women's movement, that says that there's a safe place to go where if you're a woman, you're going to be seen by other women, for instance. And when it comes to things like rape crisis centers and so forth, you're not going to have to undress, nothing, not that the male doctors committed any infraction, but we're not going to have you examined by a male doctor. If you've been sexually assaulted, we're going to give you the option to have a female doctor for good reason.
That's really important. The VA has done that, and we've had our own women's health clinic for many years now. And actually, kind of just going off of that, the majority, if not all, of the transgender veterans that we serve at the VA seek their care in the women's clinic. And I think a lot of that is preference, because they do feel that's a safe, inclusive environment. Well, that was going to be one of my other questions. Is the VA doing anything specifically for transgender population there?
We are. We are actually working really hard on transgender healthcare, and a lot of people don't realize that the VA provides pretty much all care to the transgender population aside from sex reassignment surgery. And so we provide pre and post-op medical care, we provide the mental health care, the VA provides hormone replacement therapy.
Wow.
Jesse Brown does hormone replacement therapy. You can meet with a speech therapist and do voice training. So as you're transitioning, you can meet and work with a speech therapist to kind of train your voice to be more in line with your preferred gender. Jesse Brown specifically has been participating in the transgender scan echo program. And so we have an interdisciplinary team, and we have the nurse practitioner in the women's clinic, and then we've got some mental health providers, some social workers that meet every other Tuesday, and we do a teleconference nationally with 16 other sites and an expert site on transgender care, and we do a didactic educational portion, and then we have a case presentation portion as well. And so the goal is that at the end of this program, which our last session is next week, Tuesday, we will have identified kind of an expert team of people that can provide transgender care and guidance in transgender care.
Wow, so it's happening right now.
It's happening now. Mm-hmm.
For those of you that may have just joined us, you're watching a live call and interact program brought to you by CAN TV 21. I'm sorry. And I'm Eric Prosher. This is Becky Powers. We're from Jesse Brown VA Medical Center, and Becky is our LGBT Veteran Care Coordinator, and we're talking about LGBT issues. So I work in the Transition and Care Management Clinic, our newest returning veterans from current conflicts. And so I'm kind of thinking about how are there differences between LGBT veterans from different age ranges and different eras, and what have you noticed, or what do you know, if anything?
Yeah, I think that there definitely can be. You know, it's been fairly recent in our history that we've even begun to be more accepting of the LGBT population. And I think for younger people, it in some cases is a little bit easier to be open about who they are. But I think for the older generations, and this is a generalization, of course, but I think for some of the older generations, it's more difficult. You know, you think about Korean era or the Vietnam era or even World War II era, and it wasn't acceptable on a societal level, and it definitely wasn't acceptable in the military.
Mm-hmm.
And I think the older veterans, they tend to be a little bit more closed off about it.
Guarded.
Yeah,
Mm-hmm.
guarded.
Mm-hmm.
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 Exactly.
That makes sense. As they've had to live much longer with the prejudice and discrimination
Mhm.
to play a big
Exactly.
role in our society. So again, don't forget to call us. This is a live call-in show. The number's 312-738-1060. All right. So some people might be asking, why is it important to know about sexual orientation of medical patients?
Yeah.
Why not? Is this...
I think that's
I don't
a
know.
really
So-
important question to
Okay.
ask. Is it important for your doctor to know that you identify as LGBT? And I think, you know, it kind of depends on the context. And is it appropriate for your doctor or your provider to ask you your sexual orientation?
Mhm.
You know, I come from an inpatient medical I worked on inpatient medicine at Jesse Brown for 4 years before I transitioned to the spinal cord clinic. And I think that there are some instances where knowing a person's sexual orientation might not necessarily be directly related to their admission, and therefore not necessarily appropriate for the provider to ask. However, it's also important to keep in mind that there are certain healthcare disparities that exist within the LGBT community, and they can absolutely affect your healthcare. For example, LGBT people are at higher risk for certain chronic diseases like GI problems, certain cancers. They have higher instances of substance and tobacco use, higher instances of anxiety and depression. And so when you think about it in that context, it's important for a patient's provider to understand where they're coming from so that they can better know how to treat them. If I know that the person sitting in front of me identifies as LGBT, I know in the back of my head what they might be at higher risk for.
Okay. So you spoke briefly about older veterans that may have more guarded presentation. So what happens if a veteran has concern about what's entered into their medical record, how are these concerns handled at the VA? And, or what is your guidance as the coordinator?
Yeah, I think that's a really good question. You know, we think about protected health information, and certain things are much more sensitive than others. And your sexual orientation isn't necessarily going to be protected in the same way that like HIV status is or substance abuse treatment is. And so I think it's really important for providers especially to acknowledge that what they put in the medical chart may be seen by other people. And I think it's important for patients to understand as well that if you come out to your provider, that you need to be educated on the fact that that information might be sent to other providers, for example.
We have another caller. Hello, caller?
Hi.
Hi, what is your comment or question? Thank you for calling.
Yes, I have a question. You know, if a veteran, I think that the VA has made a lot of great strides in terms of identifying concerns of the LGBT community, but if a veteran were to, for some reason, feel that they might be experiencing discrimination or prejudice within their care setting, who might be the best person for them to seek out to kind of address that concern?
That's a really good question, and it was just in April that every VA facility in the nation was mandated to have an LGBT veteran care coordinator, and I am that person at our facility. And so if you find that you are, because we know it's a work in progress, if you're finding that you're feeling discriminated against and you have concerns about the care that you're getting, you can always call me. I think we have my phone number.
Yes, you can call Becky Powers at 312-569-5941. Is that correct?
That's right.
Okay.
So I am the point of contact for Jesse Brown VA, as well as the, what do we have, 4 outpatient clinics. And so if you have questions or you're not sure where to turn, you can always give me a call. That's my direct line.
There's our 4 outpatient clinics. All right, thank you for your question. So, on the other hand, if a veteran comes and says, hey, I want to work with an LGBT provider, how is Jesse Brown honoring these requests?
Yeah.
Is that even a possibility? Because I imagine in some areas it might not be an issue.
I think
it might be an issue.
Yeah, and that is something that we have discussed over the years at our facility and something that we continue to discuss. And it kind of depends on the department and who's available. The other VA facilities, a couple of other ones, have LGBT-specific psychology postdoc fellows. So those in the mental health side of things can see that person. We don't have one right now at Jesse Brown, but that's something that as the new veteran care coordinator, LGBT veteran care coordinator, I would like to try to implement.
Okay.
But I think it's kind of a case-by-case thing right now, and it kind of depends on what you're looking at and what you need and who's available.
Wow, we have 1.5 minutes, and it sounds like we have one more caller. So let's see if we can squeeze that in before we say goodbye.
We can go a few more minutes.
What's that?
We can go a few more minutes.
Okay. I was just told we can have a few more minutes. So what is our caller?
Are you there?
Yes. Hi.
Hi. Yeah, my question is, I appreciate, ever since Don't Ask, Don't Tell was repealed, I think LGBT issues have become more and more prevalent and open and accepted. But the other side of that is, I think it becomes easier for things like Orlando to happen. And so I'm just curious to know how the situation in Orlando creates barriers for what you're trying to achieve at the VA.
Well, first of all, I'm pretty sure that that's my dad calling in right now.
I was going to say, that's a hard question, Dad. That's a hard question. We have 30 seconds.
But the other side of that is, I think it becomes easier for things like Orlando to happen. And so I'm just curious to know how the situation in Orlando creates barriers for what you're trying to achieve at the VA.
Well, I don't necessarily.
Pretty sure that that's my dad.
There's sound happening.
That's a hard question, Dad.
Oh, can you turn off your TV, please, Father?
Yeah. But the other side of it is, I think, it becomes...
Dad, turn your computer off, please. Yeah. Okay. Are you there, Dad?
Just, you can proceed with answering.
Okay, I'll answer the question. Okay. I don't think it necessarily does create barriers. I think that if anything, it makes us talk about it more. And I think that that's always a good thing. And that is not at all to discount the tragedy that happened, because it was absolutely a disgusting thing that happened in Orlando.
Yeah.
But people are talking about it. And that, I think, is a good thing. So I don't necessarily think that what happened in Orlando will create barriers. It's possible, though, that, LGBT people feel very unsafe right now.
Yeah.
And they may be less likely to come and seek care at the VA
Mm-hmm.
or anywhere right now.
Mm-hmm.
They may not feel as comfortable coming out to their providers because they don't feel safe, because it's very clear that they're being actively discriminated against by certain people. But I think that we have to consider the fact that we're talking about it, and that's a good thing.
Exactly, and that's why we're here, to let you know that you're safe, Jesse Brown.
That's
And
right.
thank you, Becky, for coming in. My name's Eric Prosher. This is Becky Powers.
Thank you very
This
much
is
for
Jesse
having me.
Brown VA Medical Center, located 820 South Damon Avenue. We'd like to thank you for watching CAN TV 21. If you want to learn more about LGBT services at Jesse Brown, you can contact Becky at 312-569-5941. And please stay tuned again next month for veteran issues. And please stay tuned for Etiquette Foundation that will follow us in 5 minutes. Here is the crisis hotline if you need help and need to talk to someone. Thank you, and goodbye for now.